Good afternoon. Welcome everybody to our monthly department meeting. Thanks for taking the time to come visit us and also to brave the wind and cold. So we're going to go ahead and get started here. I'm going to turn the, first of all, I want to acknowledge and welcome the Farley people who will be, this is a very good timing because the legislative session starts this week, right? Today. So, you know, this is a great kickoff to the events to come. So let me turn it over to Liz and Lisa. Good. All right.
Hi, everyone. As Myra said, thank you so much for being here today. We're very grateful for Rose Crompton, who will be giving us an update for our upcoming deadlines and events via HR, specifically having to do with personal evaluations, PRISM, and then, fun things as well. And then we'll be glad to welcome our Farley Health Policy Center friends, Lauren Hughes, Susan Matthew, and Kyle Leggett. Just a couple of housekeeping notes. This is being recorded and it will be shared at a later date. There's also some QR codes in front of you and then like along the back wall in case you'd like to share any thoughts about this meeting and upcoming meeting suggestions, even for topics. So please just feel free to let us know. And with that, I'll just turn it over to Rose.
Thank you, Liz. Oh, did you move? Okay, thank you. Hi, everyone. Happy New Year. So like Liz said, now that we are in our new year, we thought we would give some information to remind you of our upcoming deadlines and then also a heads up on our upcoming event. So as you know, we are in the middle of our annual performance review and PRISM review season. And the first deadline that is quickly approaching, which is January 15th. Hopefully everyone is working on their self-reviews and please submit it to your manager by the 15th. And then the next deadline is February 19th, where you and your manager should meet to review your performance. And then for faculty, please submit your review through PRISM, and then it goes to Myra for final review. And then for staff, please, after you meet with your manager, please sign the forms and then submit it through email to Kristen Waters. And then the next deadline is February 29th. That's when we submit our signed performance review rating form, which is also known as CORA, to the School of Medicine of HR. And then May 31st, that's the deadline to submit your receipts for reimbursement for the professional development funds and the continuing medical education. If you do not have a dedicated admin support, you can contact the DFM admin team. And then the last deadline to be aware of is the June 30th. So as a reminder, if you haven't used your personal observance day yet, which also known as the Juneteenth day, you have until June 30th to use your personal day. So if you have any questions about these deadlines, please feel free to send either myself or Kristen or Christina an email. All right, so our upcoming event is our annual Spring Fling. It's going to be held at the Ballasteri Vineyards in Denver. It's scheduled for Friday, April 26th from 5:30, which starts with the cocktail hour, and 6:30, that's when dinner will be served. We will have an award ceremony, and then after the ceremony, we have an entertainment, which is Mike Massey. He is an acoustic guitar artist. I've seen him perform several times, so he's really good. Okay, I think that's it. So more to come. I'll send an email, or either myself or Molly will send an email about this event. Okay, that's it for me, Liz.
Wonderful. Well, good afternoon, everyone. Thank you for the warm introduction and welcome to the first DFM meeting for 2024. Happy New Year to everybody. I'm excited to co-present today with my colleagues Susan Matthew and Kyle Leggett from the Farley Health Policy Center. Together, we'll be providing an introduction to the 2024 General Assembly session, which begins today. And by way of introduction, Susan is the Medicaid Policy Director for the Farley Health Policy Center, and Kyle is one of our scholars, and I serve as the State Policy Director. So a bit more detail about what we will cover today. I'll share a few words about why engaging in the legislative process matters. Susan and I will provide an overview of the legislative and budget processes at our state level. We'll take a look back at 2023, and Kyle will give us a preview of potentially what to expect for this year's session. And then we want to make sure everyone is aware of the monthly legislative updates that we provide. As we proceed through the conversation today, I invite you to reflect upon how the legislative and budget processes here in Colorado, literally in our own backyard, impact how we practice, what we research and teach, and what services and resources our patients have access to. As a reminder, the Farley Health Policy Center is a team of interprofessional policy experts, educators, and learners here on the Anschutz campus. We work on health policy issues and systems reform to promote whole health for all. I certainly invite you to go to our website and take a look at all the things that we do, and absolutely come and talk to us today or any other day. We'd be happy to engage with you in dialogue. So drilling down on policy, we often like to include this slide in our talks because we find in our work that these terms of policy and advocacy and lobbying can sometimes get conflated and or confused with one another. And it's important to appreciate that while they do overlap to some extent, that there are key distinctions. In the Farley Center, we look at policy or consider policy to be the work of truly drilling down, understanding and articulating problems that need to be solved, and then analyzing, designing, and or researching potential solutions to those problems with the goal of creating sustainable change. When you cross over into advocacy, there is an education component, the opportunity to educate decision makers and stakeholders about specific issues and making an ask. Individuals and organizations both can be engaged in the advocacy process. And then lobbying are specific attempts to influence pieces of legislation, either in direct support or opposition. A special note that at the Farley Center, none of us are registered lobbyists. So we do not lobby, we will not advocate for specific bills, nor will we ever advise you on doing the same. We stay true to that policy focus in our work. So why does all of this matter? I personally contend that what happens in our own state impacts our personal and professional lives, often to a much greater extent than what happens at the federal level. As such, it behooves us to pay attention and to get involved so that we can shape and inform policy outcomes. And I hope that as you, if you choose to proceed down this journey and track a bit more what's happening downtown, you will find it as fun and perhaps as challenging as the three of us do and our other colleagues in the Farley Center. But it's also important for you to know that your expertise and experience are highly valued and needed, and perhaps more than you realize in our state lawmaking process. So how could you get engaged if you wanted to? There are myriad ways that you can do so. This is not an exhaustive list. I'll highlight just a few that I think are relevant to those of us in the Department of Family Medicine. Many of us in this room are clinicians. Sharing your experience of caring for patients, families, and communities in our current health and healthcare environment, exceedingly valuable. A lot of us are involved in research or are launching or overseeing different programs. Being able to translate that perspective to inform policy change is also valuable. Certainly, if there's funding that comes available through the legislative process that piques your interest, I encourage you to consider applying for those funds. You can help implement new policy initiatives or evaluate them. And then there's also opportunities, depending on the situation, to get engaged in the regulatory process and to develop amendments to existing law if there are changes that need to be made. So I'd like to provide an example of how this department has been instrumental in shaping some of the policy that happens downtown and how we continue to be involved after legislation is passed and signed into law. One of the take-home messages that we want to convey today is that while today is the opening day for this legislative session, and it's going to be running through May 8th, day 120, when the session closes, legislative work and what happens as a result of those decisions is a year-round process. So especially when it comes to rulemaking or implementation of new programs and policies, while there's a lot of concentrated activity from January through May, that is not the only time of year that there are important activities happening. And I'd like to acknowledge, I saw him, there you are, Mark. See you back there in the middle of the room. I would like to acknowledge the leadership and vision of Dr. Mark Deutschman in a number of years of leading the rural program here at CU and helping to encourage medical students to train in rural and frontier areas and to ideally stay and practice in those same settings. The success of this program was the impetus for passing in 2022 Senate Bill 172, with the goal to address the shortage of healthcare workers in rural and frontier areas across Colorado. When this bill passed, it expanded beyond medical students to include a variety of other health professions and to create rural tracks in Colorado's public institutions across the state. There are now 13 participating institutions, which together offer 15 rural tracks and a total of 19 different degree programs. Implementation for this initiative has been underway since July of 2022. Implementation has been a collaborative effort of many of our colleagues in the department, including the Rural Program Office, excuse me, the CU e-learning team, as well as the Farley Health Policy Center. And as part of our work in being engaged in the implementation process, we've identified some opportunities where we might like to see some additional changes to the program, including potential involvement of other health professions that would require legislative change. So how can you get involved in the legislative process? As a private individual, there are many opportunities ranging on this list from some involvement to more intense involvement at the bottom of the list. For those of you that are interested in this work, learning how the process works and tracking your favorite issues or issues that are important to you is a really great place to start. If you want to become even more involved, you can consider attending town hall meetings, sending emails or making phone calls to your elected officials, setting up personal visits with your elected official. Often it will also be or only with their staff members. Those are important meetings to have. And then if you wanted to get even more engaged, considering writing or publishing various pieces or providing testimony before a House or Senate legislative committee are great ways to get involved. A few tips that we like to share, particularly for public employees, such as those of us in the room. Please use your personal email for communicating about or advocating for specific pieces of legislation, including signing up to visit your legislator and or to testify on a specific bill. It's important to be clear on when or if you represent an organization versus yourself as a private individual. And we also suggest that you wear non-branded clothing to visit a legislator and or to testify on a specific bill. So now we'll move into a brief overview. And when I say brief, this will be brief overview of the legislative process. This is one of my favorite charts of all time. And do not worry, there will not be a quiz later on this. And certainly we can direct you to this resource to review this in more detail at your own leisure. But broadly speaking, this is what it's like for a bill to become a law. And at its core, a bill is introduced, heard in a committee. It passes that respective chamber, either the House or the Senate, goes to the other chamber, is then heard in that chamber's respective committee, passes that chamber, goes to the governor, passes and becomes law. But there are many numerous nuanced steps with all those things that I just mentioned. And keep in mind that there's only 120 days in our General Assembly session. So again, we open today, January 10th, and adjournment is scheduled for May 8th. So there's a lot of activity that gets compressed into this timeframe. Certainly, not all bills become laws, and progress can be stymied at many points along the process. It may never be considered in the committee to which it was assigned. It may never be given airtime at all to be heard or to be debated. If the House and Senate pass different versions that can't be reconciled, then that represents a dead end. And then the governor may decide to veto a piece of legislation that comes across her or his desk. So let's talk about the 24 session by a few key numbers. The first one is 120, which I've already alluded to. This is the number of days the General Assembly meets per the Colorado Constitution. 100. Our General Assembly is comprised of 100 citizens that are elected or selected. I'll come back to that, to serve their peers. This breaks down into 65 representatives and 35 senators. And you see here the approximate number of citizens that each of those different leaders would represent on average in our General Assembly. 46 to 19 and 23 to 12. These are important numbers. The first represents the Democratic supermajority in the House, and the second represents a Democratic majority in the Senate. There's one seat short of a supermajority in the Senate, so it's as close to a supermajority in both chambers as you possibly could get. Where the supermajority comes into play in terms of additional authorities is that chamber can override governor's vetoes, call for a special legislative session, and or refer constitutional changes directly to the voters. 2027, another important number, just appreciating the political landscape in which policy proposals must navigate. This is the anticipated next realistic opportunity for Republicans to assume control at the state level here in Colorado. And this is because the 4 state level offices, the governor, attorney general, secretary of state, and treasurer are all presently held by Democrats through that time. 29, another important number that I personally am still kind of working to wrap my head around. And this is the number of Colorado lawmakers out of 100, so nearly a third, in this year's General Assembly who were selected, at least initially, by vacancy committees. And that process, not elected, but were selected through that process. And that is 11 senators and 18 representatives. So I'll put a pin in this. That might be something that we track on as the Farley Center throughout this session, because there are some rumblings about whether or not this particular process needs to be modified. And then 4, based on a couple of days ago when this article came out, this is the number of incumbent state lawmakers who will face primary challenges this year. This number may change over time, but that's the number that we have at present. Despite majorities in the House and Senate, Democrats face substantial challenges. First is all about the money. There is often not enough money ever to fund desired programs. You will hear from both Susan and Kyle a theme that has echoed over the last couple of years, which is implementation for really big initiatives takes a long time. And do we need to focus on that versus thinking about new initiatives? Keeping the legislative calendar running smoothly and herding all the cats is not a small feat. There are inter-party differences between progressives and moderates within the Democratic Party. And within the past couple of months, we've had 2 freshman Democratic lawmakers that have recently resigned for various reasons, and Kyle will touch upon this a little bit later as well. And then, in case you didn't realize, another election year is upon us. So it's going to have substantial impacts here at the state and the federal level, depending on how all of this plays out. So a few dates. This is just a snippet from this very rich resource that you see listed here that lays out all the key dates for the 74th General Assembly. And we're in the second regular session, so the second year for this particular General Assembly. Again, today, opening day. On the 28th of February is an important date in which this is the final passage of bills in the originating chamber. This is day number 50 of 120. I'll also mention the 76th day, and Susan will touch a little bit upon this a bit more in her portion. March 25th, this is when the long bill will be introduced in the House, and that is the budget for the next state fiscal year. I will also comment briefly on the 101st day, April 19th. This is the deadline for the passage of public school finance bills here in Colorado, and then adjournment is scheduled for May 8. There are a whole lot of other dates, so that resource is a good place to go. In general, at a high level, the cadence breaks down kind of in this way. January and February, things start to heat up. March, April, and May, it tends to be a bit more of a crazy madhouse downtown with hearings and conversations and advocacy, et cetera, et cetera. And every year, there does tend to be important bills that die simply because the clock runs out of time on May 8th. The key take-home point from this slide, this excellent graphic from our colleagues at the Colorado Health Institute, is that there are numerous bills introduced each year. That's really it. And you can see here that they range from 598 to 721 introduced bills since 2016. And then the darker shade is the pass rate, anywhere from 51% to 82% of introduced bills then pass and through that process. So all this to say, when Kyle mentions at the end our legislative updates, there is no humanly way possible that the Farley team is tracking on 600 plus bills that are introduced. There's lots of tools and resources to help you do this if you're interested, but I think it's important to appreciate the introduced bills and the pass rate every year. So the last portion of my comments, I want to focus on 4 different types of committees that help get this important lawmaking work done. And again, I'll go back to my comment earlier that the legislative work here at the state level is not just confined to January through May, as you'll hear in my comments. It really is a year-round process with different cadences throughout. The House has these 10 committees of reference. The committees of reference primarily meet during the legislative session to consider legislation and to provide oversight of executive branch agencies. Because it's very pertinent to us and the work that we do, I do want to provide the scope for the Health and Human Services a committee of reference. This committee considers matters related to state health and welfare programs, health insurance, social services, and environmental health. The committee also has legislative oversight responsibility for the Department of Healthcare Policy and Financing, or Medicaid, the Department of Human Services, and also the Department of Public Health and Environment. So many things that we research, teach, practice will be pertinent to this particular committee of reference. The Senate similarly has their committees of reference. The scope for the Health and Human Services Committee in the Senate is the same description that I just provided for you on the House side. So it's nice to have some of those synergies across the Senate and the House. In addition to similar responsibilities for House committees of reference, Senate committees of reference also conduct confirmation hearings. Then there are year-round committees. These are often permanent year-round committees that meet both during the legislative session and then, as is apt in the description, also between legislative sessions to provide oversight to legislative staff agencies. They conduct hearings regarding the state budget and capital construction projects and consider other issues of importance to the state. And then lastly, interim committees. These are the current interim committees, and they meet as sort of described in the terminology in the interim between legislative sessions to consider issues of importance to the state. These are established by the legislature for different lengths of time, and each of them have different areas of focus. Certainly, given recent extreme weather events here in Colorado, you can appreciate that Wildfire Matters Review Committee would be an important interim committee to have. I also want to acknowledge the Opioid and Other Substance Use Disorders Study Committee, because Kyle will be talking about potential legislation coming forth from those discussions in that interim committee this past year. And last but not least, this is a superb website. I have worked and served in other states, and I will say that Colorado really gets this right in terms of its General Assembly website. Lots of great information, fairly intuitive to navigate, incredible resources. So if you want to go down the rabbit hole of learning more about the Colorado General Assembly, I strongly encourage you to check out this website that is through the Office of Legislative Legal Services. So with that, I'll say thank you and turn it over to Susan to talk about the budget process.
Great, thank you. All right, budget 1.0, this is probably like budget 0.5, but we'll see if we can get you all up to speed a little bit. Like the legislative process, the budget process is a year-round activity. A couple of key dates: November 1st of every year, the governor submits his formal budget. That budget has been developed over a period of months through stakeholder meetings, state agency requests, governor priorities, and throughout that process, some proposals end up on the chopping floor and do not make it into that final budget. Starting not long after November 1st, the Joint Budget Committee, which is a year-round committee that Lauren mentioned, starts with their briefings and their hearings. So the briefing, essentially JBC staff present to the JBC membership, which is made up of senators and representatives, as well as members from both parties. They submit the governor's budget agency by agency. During that time, legislators ask questions or seek clarification, and then the agency comes back a couple of weeks later and provides answers to those questions, as well as provides some additional context during the hearing. After that, there are multiple session hearings throughout the legislative period. Updated revenue forecasts may change some of the proposals depending on revenue that's available for expenditures during that year. And ultimately, the long bill, which Lauren mentioned, is introduced and moves through the legislative process just as all of those other bills do. The governor then signs it or can make a line item veto. Generally, by that point, the governor signs the full bill and does not pursue any vetoes. Tabor, I'm sure you've all heard it. Colorado is unique. It is the most restrictive limit on spending in the country, and it is in our Constitution. Essentially, it says that the state can retain and spend an amount based on the prior fiscal year's actual revenue or limit, plus adjustments for inflation, population growth, and voter-approved revenue changes. That means we, the voters, have to approve tax increases and give permission to spend money that is collected under the existing tax rate if the revenues grow faster than the rate of inflation and population growth. If the voters don't approve that, the excess revenue must be refunded to us, and that's where we get our Tabor refunds. As I said, it's the most restrictive limit. It means that we as a state are not always able to make long-term investments that other states are able to make. Last year, Senator Zenzinger, who was the chair of the Joint Budget Committee, addressed this when she said about the 2024 budget, which we're halfway through right now, quote, "It's a paradox because here we have the revenue, it's growing. We have Tabor refunds that will be expected, but at the same time, we will not be covering the rate of inflation plus population with existing services." This year's budget is $45 billion. That is the request that the governor made on November 1st. You can see that the Department of Healthcare Policy and Financing, or HCPF, that green wedge towards the bottom, is the largest single line item in the budget. About a third, a little more than a third of total funds go to HCPF, and a little bit less than a third of the general fund, which is the state revenue and funding goes towards HCPF. That's why the Joint Budget Committee and other committees spend a lot of time focusing on HCPF's budget. It's a big part of where all of our money goes. So what's in this governor's budget that he put forth? First of all, there's a return to normal levels post influx of pandemic and pandemic related dollars, or those ARPA dollars. There is also as part of that, which I'll show you on the next slide, there is some money that has been requested to help smooth that transition, kind of what's being called the ARPA fiscal cliff. There is a request to fully fund schools and to increase teacher pay. We as a state have not fully funded our schools since the Great Recession. There's money for some housing to create some more dense housing near transit stations, and then there is $272 million in new money for healthcare. This includes money for the Social Health Information Exchange, some additional resources for behavioral health providers providing services in schools, and then finally some provider rate increases to the Medicaid program. Those provider rate increases kind of take two forms. There's ATB, or across the board, which means everybody gets, in this case, the request is for a 1% budget, a 1% increase over their current rates. And then there are also targeted rate increases. This year, some of those rate increases go to home and community-based providers to support mandated increases in the minimum wage in some municipalities, maternity services, some surgery, and some increases to a primary care fund that helps support primary care for indigent and uninsured populations. There's also a request to reduce rates for anesthesia. So budget requests are also inclusive of reductions as well as additional dollars. There are some requests for air quality improvements, improved enforcement of environmental regulations, and then some water infrastructure dollars. Finally, more money for food, especially for kids, childcare, and then some additional support for the new universal preschool program, which was signed into legislation just a couple of years ago. Back to Tabor, the governor has asked the General Assembly to reclassify some revenue as Tabor exempt, which would have the impact of increasing state funds and decreasing those Tabor refunds. So this is just a snapshot of some of what has been said since November 1st. There's general agreement across both parties that K-12 and funding education is a priority. I think Colorado is 45th in the country right now in terms of our support. The Republicans want to make sure charter schools are counted in any of those increases. They're also concerned about overall tax relief. Everyone is aware, as you can see in Governor Polis's quote there at the bottom, that there's not a lot of new money. The fiscal cliff is looming, and there may be little room for funding of new programs. I am going to shift now and just take a few minutes to talk about kind of where we were last year, to tee up Kyle, who will come and talk about what is coming next, or what will be coming since we started today. Last year, there were 617 bills introduced. Roughly 80%, so 79% of those were sent to the governor for signature. Lauren talked a little bit about the cadence earlier. You can see that 182 bills were undecided with 5 days remaining in the session last year. One might argue that management of the process could use a little improvement. This delay is probably a function of several different things. One being some disagreement across the majority party. And then the other is a delaying tactic that a lot of minority parties use, which is to really slow the process down. So for one example, they had there was a proposal to read every single bill word by word the first time it appeared in session. That can be very time consuming, as some of these bills are quite lengthy. Partisanship was slightly up this year, and the governor did veto 10 bills, which is the most since 2019. We also had a special session. This is the governor with his bat and sunglasses breaking the proverbial in case of emergency glass to call the legislature back for 4 days in November to address the high cost of housing. This was part of a domino of a failure of a piece of land use legislation, and then the failure of Proposition HH, which appeared on our ballots. His proposal was to then bring everybody back to come up with some solutions. They ultimately passed 7 bills in those 4 days. 6 were kind of short-term tax code changes. And then the 7th was a bipartisan committee that would study longer-term solutions and make some proposals, which I think is due in April. Kyle will talk about that. Last year, when we provided updates, as Lauren shared, there's no way we can provide much of information on 600 bills. So we really tried to focus our lessons and kind of what we talked about in several different general areas. Health, I won't read them. We're going to walk through these 5 right now. Healthcare access and cost, obviously, an area of interest to all of us as consumers, as providers, as mental health, or excuse me, as health clinicians and people who work in this field. There was a lot of focus on reducing cost. That continues to be a top focus. A lot of advocates had some really great ideas on what to do with that. And there were also opposition coming from systems and hospitals. We talked a lot ourselves, as well as just kind of across the campus. There was a lot of conversation around the facility fee bill. Ultimately, this piece of legislation was adjusted such that there was not going to be the impact, and there will be a study in terms of seeing what is possible in that area. Transparency is popular, and there's broad awareness with some proposed solutions about healthcare workforce shortages. We, as a state, continue to strengthen access to reproductive health services. This is really a byproduct of the Dobbs decision, as well as actions in other states. I'm sure we've all heard about the increases to the number of abortions and other services that are being provided here. Opioid and substance use disorder are also a continued high priority here, as well as across the country. There's a continued focus on the balance between ensuring there's treatment for those in chronic pain while still limiting inappropriate prescribing, as well as continued tension around the role of criminal penalties and adoption of harm reduction approaches. Kyle's going to talk in a minute. There was the interim committee for this, and then Kyle will talk a little bit about some of the pieces of legislation that came out of that interim committee. CPR said it better than I can. Arguably, this was a really consequential session for gun violence. There were long debates, all-night filibusters, and ultimately multiple pieces of legislation passed. There was a gun industry, ability to sue the gun industry, expansion of red flag laws, and then a 3-day waiting period and increased minimum age of purchase, both of which lawsuits were filed almost immediately, and those 2 are on hold. There was also an assault weapons ban, which never made it out of committee. Finally, there was a lot of activity around education and school finance. Obviously, still a continued area of focus as we seek to fund schools fully. Some changes to food access for Coloradans, better EV charging and some environmental activity, and then housing, which is continuing to be a challenge. As I mentioned, the special session, that was part of the domino effect that started with failure of the land use bill 5 hours before the end of the session. So stuck in the big group of bills that did not move quickly, except for at the very end. There was a lot of opposition to that bill, and even though it went through multiple iterations to try and make it such that it could be passed, it ultimately failed. Now I will do a cut.
All right, can everyone hear me okay? All right, good. Try to adjust the mic. So we're going to look at what's coming down the pipeline in 2024. This is in no way an exhaustive list. This is our best estimate based on our conversations on what's being reported across the state and kind of keeping a finger on the pulse of the legislative trends. So a lot of this has already been talked about, but there's a lot of context for this session, right? Number one, the housing session that Susan just mentioned. That is going to put a frame on a lot of the housing related bills and the affordable housing kind of aspect of things. The term that I keep seeing thrown around is acrimonious, which I had to look up personally, but really meaning bitter, almost vitriolic. And what's different about maybe this than it has been in other years is that this is being thrown around not just between parties, the minority and the majority party, but actually within the majority party as well. So you may have seen that we had a couple of Democratic lawmakers who sued the Democratic leadership. We have seen 2 Democratic House members resign in the last few months, both of them citing the vitriolic or acrimonious kind of environment. And we've seen a couple of reprimands from House leadership on the activities and the kind of decorum of other members of the House. So that's different than we typically see in a majority party. But we still have, as Lauren pointed out, a supermajority in the House and a close to supermajority in the Senate, along with the Democratic governor and all of our state agencies and positions. So where are the areas of focus going to be in 2024? Pretty much everyone is in agreement that all the problems that faced us in 2023 are still around in 2024. And so a lot of this is going to be continuing our current focus areas. And, for us in healthcare, it's going to be access to affordable healthcare. It's going to be strengthening primary care. It's going to be opioid and substance use disorder, and it's going to be better access to affordable and quality mental and behavioral healthcare and healthcare workforce issues. But on the bigger picture in the social drivers of health, we're going to be talking about affordable housing, we're going to be talking about property tax relief, and we're going to be talking about education. So a couple of caveats as I move into the next slides. None of these bills that I'm going to talk about are actual bills yet. They have yet to be introduced. They don't have bill numbers. These are proposals. These are ideas. These are concepts. And some of them are really well fleshed out, and others are single line items that we've had a lawmaker say in a single newspaper interview, right? So all of these bills are going to go through some amount of change as they get introduced during the legislative process. That is part of it. But one of the things I want to really impart on you all is that many of these bills have been worked on for the last 6 months, either during interim committees or in the off season. And that is a fantastic way to engage and educate our lawmakers on the importance of this topic area. And if a bill comes out of an interim committee, that means that it has gone through a 6-month vetting period in a way that bills that are introduced in April don't necessarily get. And so those bills tend to move through the process smoother and have a bit more support. So if we're looking for ways to engage as an individual or as a program to educate our lawmakers, the interim committees are a fantastic way to do that. And then lastly, this was said as well, but I just hear it both in my personal and professional life. Many of our state agencies, many of our advocacy organizations, and many of our lawmakers even are focused on implementation of existing policy. Because when you implement something like the Colorado option or the Prescription Drug Affordability Board, it takes years to get those up and running and to be successful, and a lot of work. So talking about affordable housing, we do expect that the land use bill that Susan just mentioned is actually going to come back. That has been stated by leadership multiple times. The difference is that it is probably going to come back in bite-sized pieces. There's a lot of disagreement around each of those pieces. And so there's thought that individually they can be addressed as opposed to all together, where there might be disagreement for reasons that don't quite fit together. Tenants' rights, making it easier to sue landlords who violate I can't say that word, but standards of living, right? We're going to try to support renters through income tax credits and then property tax relief. As Susan mentioned, we had the failure of Proposition HH on the ballot. There is a bipartisan tax commission that was created in the November special session. They're supposed to have a report out in April. So there's kind of this question of, are we going to have a late April property tax bill? I find that exciting, but I don't know, maybe it will. Talking about healthcare access and cost. This is a top issue for Coloradans. It's a top issue for healthcare providers and those of us who work in the healthcare system. Just to list a few of them, the second bullet here is some of the big bills that have been passed in the last few years. Any one of these is a massive undertaking, but we have the Prescription Drug Affordability Board. We had the Hospital Community Benefit, Colorado Option, or the Colorado Public Option as it was originally known, the facility fees, the Primary Care Payment Reform Collaborative. We've had multiple bills on primary care payment reform, specifically around APMs. All of those are currently being implemented. But what we expect to see in this upcoming session is, again, a focus on investment and access to quality primary care. There's probably going to be some bills that focus on primary care APMs again. We always have bills that cover health insurance cost and coverage requirements, and those two usually are a little in opposition to each other, right? If you mandate an insurance cover more things, they oftentimes raise the cost to cover those things. Facility fees, again, I don't think so in this session. We're probably going to see it in 2025. The outcome of the last facility fee bill in 2023 was the creation of a study group. That study group is currently meeting. If you are interested in that, I highly recommend joining the meetings. You can be there as a public member. It's fascinating what they're talking about, and they will be developing a set of recommendations on what to do for facility fees coming forward. Workplace violence in healthcare. This is a big issue that CHA, Colorado Hospital Association, is championing, but it's the idea that we need to do something to reduce the violence that is perpetrated to healthcare workers in the healthcare setting, in clinics, hospitals, et cetera. Access to gender affirming care. So that can include enshrining that access in the Colorado Constitution, for instance. It could be the use of preferred pronouns and mandating that in schools. All of these are ideas that have been floated in the last few months. Behavioral and mental health care, again, top issue for Coloradans. Suicide deaths continue to go up. Substance use disorder deaths continue to go up. So many of the bills.
We have like a health fair that we're doing.
Oh, that's not like a.
No, that's a.
I don't know where that audio is coming from, but I'm going to continue. If it keeps going, I'll know to shut up and leave the stadium or the podium. So we had a lot of bills passed over the last few years. We created the Behavioral Health Administration, or the BHA. That's a huge step forward. But as you all probably have seen in the newspaper, or if you've kept kind of an eye and ear open to this, really complicated and kind of not going very smoothly. So there's a lot of effort and energy that's tied up in trying to get the BHA up and running. We've had the passage of mental health annual exams, behavioral health parity, both for payment, access, and workforce, and an increase in school-based mental and behavioral health services. So what have we heard that we expect to see over the 2024 session? More bills on behavioral health integration with primary care, a youth mental health focus that includes expansion of crisis services for youth and school-based services for youth in behavioral health kind of realms. And then this is not just for youth, but I think also for all of us. There's a big interest down at the Capitol on the impact of social media on mental and behavioral health. I don't know what that may look like when it comes forward in a bill, but it is likely to come forward in that area. And then there's a big intersection between the criminal justice system and those who experience severe mental health and or have substance use disorder. And so there's this trend towards trying to find alternatives to incarceration for people who have severe mental illness and or substance use disorder. So speaking of opioid and substance use disorder, we've talked a little bit about the interim committee. I just want to point out the interim committee met 6 times from June to October 2023. We had state agencies, advocacy organizations, individual providers, pharmacists, and many others who testified during that session to provide educational information, to maybe point out what they think might be solutions. So just pointing that out as an opportunity to engage in the process. And with that, they came forward with 4 bill recommendations for the 2024 legislative session, which I will go into in brief detail in a moment. But during that, we also saw that the interim committee voted down a proposed overdose prevention center bill, in part because of Governor Polis's threat to veto that bill and pressure to not have opioid prevention centers in Colorado. So just pointing out that these interim committees are really influential in what bills are going to come forward in the next legislative session. So the 4 bills, I'm just going to call them Bill A, B, C, and D, tend to follow a trend that we've seen over the last few years, which is in Colorado, we are chunking our opioid and substance use disorder bills into categories. So the first one is the prevention of substance use disorders. There's some discussion around modification of the prescription drug monitoring program, or PDMP. I sigh before I say it, but potentially adding more drugs that would be mandated to review PDMP before prescribing, potentially adding more drugs to what is going to be added to PDMP. And in its original form, there was actually a proposal to put all prescription drugs on PDMP as mandated reporting. That's no longer there, but just telling you that that was floated as an idea. There's also money for grant programs for community-based organizations to fill kind of needed gaps in community services, and data sharing so that our partners at, for instance, the School of Public Health can better track and monitor opioid and substance use data to give us the best up-to-date information. The second bill, the treatment of substance use disorder, there's a pilot program for criminal diversion. This may be of interest to you all. There is a proposal for limited pharmacist prescribing of medication-assisted treatment, or MAT, similar to the programs that pharmacists can currently prescribe for HIV post and pre-exposure prophylaxis, for instance. It would be a protocolized MAT program for substance use disorder. The Bill C, substance use disorder harm reduction, is really just clarifying that harm reduction centers can provide drug testing services and use money on the equipment for that. And then Bill D, which is the recovery from substance use disorders, would create a program within the Department of Labor such that an employer could become a recovery-ready workplace and receive tax credits for that. And it also does some zoning changes to declare that recovery residences and sober living facilities count as residential for the purposes of zoning. So a really wide variety of what's coming out of this committee. Probably what's most directly interesting to our department and our clinicians tend to be the first 2 bills. Prior authorization, term to strike fear in attending clinicians' hearts. There is a really big effort being spearheaded by a large coalition you can see on the right of many healthcare provider organizations and groups, but really Colorado Academy of Family Physicians, Colorado Medical Society, and others are spearheading an attempt to simplify and streamline prior authorization at the state level. So one policy proposal, there's a couple of them in there, these are broad strokes, not specifics, would be to end repeat prior authorizations for chronic conditions after you get initial approval. Linda, thank you. I like yeah, we like these things. This is why we like CAFP, right? Pay your dues. That's me as a board of directors speaking. It's also to extend prior authorizations to last longer, right? What use is a 3-month prior authorization? So trying to extend it to be at least a year or for the duration of treatment. Improving the transparency through standard formulary templates for the different insurers and for standardizing the prior authorization criteria, and then posting prior authorization data on publicly available websites to try to increase transparency. And as Susan mentioned before, transparency is one of those things in the healthcare sphere that crosses the aisle. So we tend to see a lot of support for transparency efforts. What I will say is that there are a lot more healthcare related ideas that are being floated. There's a potential bill that would put reproductive healthcare on the access to reproductive healthcare services, including abortion, on the ballot for being enshrined into the Colorado Constitution, for instance. It really ranges the gambit. There are dozens of proposals out there, but the caveat that I said, none of these are actual bills yet. These are ideas, concepts, and proposals, and we'll start seeing these bills be introduced in the next few days, but probably towards the end of the month and into early February. So if you all want to track on bills yourself, this website, as Lauren mentioned, is actually really intuitive and useful. But so that you don't have to do the work of combing through the website, I invite you all to join us at our monthly legislative updates. It is going to be the last Wednesday of every month, January through May, from 2 to 2:45 p.m. The first one is going to be the 31st of this month. You can email us at Farley Health Policy Center at CU Anschutz for information, or reach out to myself, Lauren, or Susan. We'd be happy to connect you and have you join us for these updates. So with that, I think thank you all for your time. And with any remaining time, we'd be very happy to take questions either online or in person.
Kyle, Lauren, sorry, we have a microphone that will be circulating around if you have a question in the room. So we're running up against time. So I think we can entertain one or two. And thank you all for being here again today.
Since it was on one of your slides, I just wanted to point out that there are 2 lobbying groups that you can work through, and you don't need chancellor approval to represent yourself as a family physician. So Colorado Academy Family Physician has a very active legislative work group and lobbying ability, and the CMS does as well. So those are good things to get involved with. If you're willing or interested in testifying on an issue or a bill, I would coordinate with those professional organizations, because it helps amplify your voice and it gives you the ability to say, I'm representing family docs in the state. So just, I want to make sure that we know there are other effective lobbying groups that have a different approval process.
Yeah, thank you for that. I think that's a great point.
If we have no other questions in person, we just have one online, if I can ask.
Yeah, please.
Do other states have similar legislative sessions, timelines, length of session, and sorry, are they universally the same length in different states as well?
Yeah, that's a great question. The short answer is they are very different state to state. So I'll give you an example. Where I was born, New Mexico, they have an alternating short and long session every year, 3 months, 1 year, the next year, 6 months. California, as our largest state, is year round, and it is a true full-time job and everything in between. So yeah. Yeah. Yeah, so wildly different state to state. Great question.
Well, we have hit time. So thank you very much, everyone, for being here today. Thank you again to our speakers.